Now we're getting into neurotissue. Again, these are more likely the repetitive types of injuries. But like we said, in some situations, trauma can cause a narrowing of that carpal tunnel. But typically, you're going to have carpal tunnel syndrome. It's going to be more likely in women. And I don't know the exact reason, but I'm guessing maybe is that women are going to tend to have smaller wrists, so you're going to have smaller tunnels, and you're dealing with smaller tissues going through there. And occupational repetitive hand movements, anything that's going to cause encroachment into that tunnel, whether it be swelling. A lot of times pregnancy tends to be swelling throughout the body, so that maybe they'll kick in, the carpal tunnel will kick up during pregnancy. And basically the pathology, as we've talked about this before, affects the median nerve, right? Anything that's pressure on that median nerve going into the fingers. And again, we've talked about that's where the symptoms are, right? The median nerve distribution into the hand. It's right here. A lot of times it's as a result, people will notice that they wake up in the middle of the night or they wake up in the morning and they have carpal tunnel symptoms. It's because they're sleeping like this. Right? So one of the things that they do is they wear a splint called a cock-up splint, where they keep the hand from going into that position. We talked before when we talked about the cubital tunnel. You know, somebody again, if they're sleeping, you know, maybe like this, or they put their arm like that for extended periods of time, it can affect the nerve here. And now we're talking about the carpal tunnel. They tend to be sleeping in this position. And so, if there's progressive over long periods of time, it can progress to where you have atrophy of the thenar muscles. So long periods of loss of nerve supply to a muscle, you're going to get atrophy. And then that's what we're seeing right here. But that's not something that's going to happen overnight. It's over a long period of time. And now you can also have the nerve affected at different areas. And there's what they talk about as a double crush syndrome. What that is that someone can have a nerve root impingement up here in the neck, and they can also have impingement at the median nerve in the carpal tunnel, and those kind of accentuate each other. You know, it's like the story of 1 + 1 = 3. They have problems here, they compound each other. All right, so then when we talk about nerve tests, what are the 3 different ways that we're going to test nerves? Right, tapping, so there'll be a test for that. That's like here, we talked about a Tinell's for here. Now we're going to have a Tinell's for the wrist. All right, then what's this going to be doing?
Stretching.
Yeah, so that's going to stretch stretch the nerve. So this is called Prayer's test, or it's a reverse phalanx. And then, so this one is phalanx, so what are we doing here? I mean, what are we doing to the nerve? Yeah, we're kind of narrowing that, compressing that tunnel there. Okay. So when we do the special test for carpal tunnel, that's what they're going to be. It's one for tapping, and then also compression. So you can put pressure on the carpal tunnel. In this case, you're going to do it with double thumbs and hold pressure on that carpal tunnel. All right, so there's tapping on it, compressing it, stretching it, and then narrowing the tunnel. So tell me about this test now.
This is the sleep.
And what nerve is it for?
The median nerve. It begins here and then it goes to the bedtime tap.
Okay. And what kind of symptoms are you looking for when you do that?
We're looking for numbness and tingling radiating down into her fingers.
Which fingers?
These 3 fingers.
Okay.
She need to wake up and smell the coffee.
That's cranial nerves. We're not doing that. Now this tunnel of Guillain syndrome, there isn't really a special test for that. But basically what's happening is that there's pressure on this area that's causing the nerve injury, and you're getting numbness and tingling in these fingers here. Okay, the way you can get that is like if you're riding on a bicycle where you're kind of up on the top of the handlebars, like with the drop handlebars, and you're constantly pressing on that, that can do it. anything that's putting constant pressure in there. Again, like if somebody's operating some type of equipment that they're pressing on there, or if they're doing like this, or if somebody is in a wheelchair, put pressure on that. And then basically, like we said, the tingling, you're going to have tingling and numbness in the last two fingers on both sides. And then if somebody has a long-term problem with that, they could have atrophy of these muscles here, that we call the hypothenar area. Well, and then I think it's probably in the notes, but I don't know if I mentioned specifically. One of the main things that so we're going back to carpal tunnel just for a second. Carpal tunnels, they're going to have weakness of the grip. That's one of the things they're going to mention. They can't grip things, they can't open cans, they drop things, they can't carry their groceries. So that's one of the things they'll complain of with carpal tunnel syndrome. Yeah, so like on page 98, under signs and symptoms, towards the top of the page under D, it says weakness, grip strength. As far as their complaints, that's one of the main things that they'll say. Is they'll say they have tingling in these fingers, and they'll say they can't grip things. But a lot of times as soon as somebody has pain in their wrist or their forearm, and they're like, oh my God, I have carpal tunnel syndrome. They'll come in to see you and they say, I have carpal tunnel syndrome. And you say, well, tell me about it. You say, well, it kind of hurts in my forearm here when I hold things like this, and I get pain coming down into here. Okay, well, what's one of the main things you're going to want to know to ask them to determine if it's carpal tunnel syndrome or not?
Does it
Actually radiate into the fingers.
Does what radiate?
The numbness or tingling.
Yeah, numbness and tingling. We're not talking about just pain. Okay, you say, do you have any numbness and tingling in these three fingers? Do you have any weakness or decreased grip strength? You say, no, I don't have any numbness and tingling. It hurts. It hurts right here in my wrist. They probably have more likely like a tendonitis type of problem. And most of the time when people say they have carpal tunnel syndrome, most of the time they don't have it. Right, so now we're moving back onto radial nerve. It's on page 99. So again, now they're going to get compression of the radial nerve. It's going to be here at the back of the wrist, and it's usually going to be from something like a tight wristband. So it's this chronic compression of that nerve. They're going to have decreased sensation right here, or they're going to have numbness and tingling. Range of motion's not really going to be affected. Neuro, those have decreased sensory. You probably aren't going to notice any kind of atrophy or anything right there. It's all just pretty much skin and bones on the back side there. All right, so now we're moving from neurotissue, now we're talking about vascular tissue. And the one issue with vascular is, as far as chronic, or in this case, it's not really a repetitive injury, it's more of like a systemic disease, where in Raynaud's disease, you have two different things happening. At one point, you can have paleness or blanching or whiteness of the fingers, and then it can rebound with redness. So you're going from redness to pale whiteness back and forth. And then as far as tests for that, you can pinch the nail beds to check the return of the blood. When you pinch it, it turns white, and then you're looking for the redness when it comes back.